Hello, and welcome to the Data Slayer podcast, where insight meets impact, brought to you by the team at BLUE.POINT Supply Chain Solutions. BLUE.POINT is a data intelligence platform with a focus on clinical product utilization. In today's episode, we are going to discuss the problems around shortages and recalls in the healthcare supply chain. This will be the first part of a two-part series on this topic, as it is very important and a comprehensive issue. Part two will focus on how to manage shortages and recalls successfully. I'm your host, Jennifer Doty, and joining me from BLUE.POINT are Anne-Marie Orlando, the Vice President of Clinical Services, Keegan Smith, the Senior Manager of Analytics and Product Development, and Sarah Hobbs, the Clinical Program Director. Welcome, everyone. Nice of you to join me today.
Hi.
All right, well, let's just get right into the first question then. So since 2020, there has been a public spotlight on the healthcare supply chain, particularly around shortages and recalls. Was this the first time you were acutely aware of the global impacts? I can start with you, Anne-Marie.
If not for me, I mean, I was a supply chain director way back when Ebola first came around. And so what was that, 2013, 2014 or so? And that created a significant supply shortage. I think that was the first pandemic that people were very nervous about not having the right protections in place for staff, within our hospitals. And that was the first time that I experienced, I know at my facility, a lot of attention around how I was managing my supplies, how I was managing the inventory. Run rate became at the tip of everyone's tongue within my facility, and no one had ever cared about what my run rate was. So when you think about, how often and what your turnover is for some of these products, that wasn't something that anyone really paid much mind to. But, so that was the first time that I actually experienced that. But I want to say, I don't think the general public really understood the impact of recalls or shortages, or they didn't really experience, it wasn't in the news as in terms of shortages. And it did back then, force me to think outside the box for products, right? You think that one route is always the route you should go. And then you realize, oh, wait, there's other places that I can go, other vendors that have this product that may have what I need with the same clinical efficacy. But again, it was in my little world, within my hospital. I think 2020 changed it to everybody was talking about it. It was on the news every night. Anyway, that was kind of my first experience.
Yeah, it seemed to also affect a lot more people that we had, personally, our family members, and
Yep.
So I think that's
absolutely.
once it comes into your sphere, that's when
Yep.
You definitely start paying attention.
Yep.
How about you, Sarah?
Well, I wasn't a supply chain director back when Ebola hit. I was actually a nurse on the floor. So the impact hit me different, because then it's like, oh my goodness, am I going to be protected? And you think about that. I think you think about that in general, even in supply chain, right? How am I going to be affected? But this was, do we have enough product? Is that the thing? And you're right, run rate became the word, right? And shortage became the other word, and everybody was really
and donning and doffing.
Yes.
Do you know how to properly don and doff?
And we had a team that did that. How do you get it on? How do you get it off? Yes. And so I was aware of it, but I was aware of it differently, right? And then when COVID came, I was in value analysis. And so that really changed my focus. Like, how are we going to find hand sanitizer? Do we have enough? How are we going to get the right PPE? I mean, do we have enough masks? Can we reuse them? How are we going to do that? What's clinically safe? So I was aware of it, but it's funny how your role shifts, right? When you are a nurse on the floor or a patient at that, and you're thinking about these things, and then you are in supply chain trying to get the stuff, the items and the products that are actually short, and you're trying to figure out which way and how you're going to do it and what is clinically viable and safe for the patients and for the nurses that are working and taking care of those patients.
I'd have to say for me, 2020 on supply chain and shortages was the first time. My background in public health, I definitely knew how outbreaks and pandemics can globally affect an area in things, but I never really put it into what happened in 2020 and with COVID and seeing the spend rise for members, seeing suppliers that we hadn't seen in specific categories before, and just how everything was shifting within the data that we were receiving. And then how do we put that out? Like, how do you help in tracking that type of stuff for members, for facilities, and, how do you gear them to know and arm them with what they need to see and know that financial impact. So it definitely was the first time for me in 2020. It was very eye-opening, and now I feel like it's talked about all the time, which I think is a positive. It's good to have that insight.
Yeah, I think it's interesting because, I remember when I first got into supply chain, it was, I don't know, way back in, was it almost 17 years ago. And you had that mentality of, what do you like? I'm always going to have access to this.
Mhm.
Like, this is always going to be there for me. And I can stock as many as I want, and I'm never going to run out. Like, that was the mentality you had, because on occasion, yeah, you'd have a back order here and there. It was like a random thing. But suddenly it became real, and I think over the years, we had the PPE shortages, but then we've had hurricanes, we've had natural disasters, we've had endotoxins in a everyone now is talking about neuropatties or neurosponges, right? So in finding endotoxins in those, and suddenly it's like, how do we actually how have we come to a place where suddenly we actually don't have that product, we don't have that plethora of supplies? It's just interesting.
Yeah, it almost mimics, I mean, not mimics, but it's always a problem that is not just isolated to healthcare. I remember for myself, throughout life, you had shortages. A lot of times it was food shortages. As some year where there's, no strawberries available. And we kind of, hear in the news about why that is. And then with COVID, there was no toilet paper, and
Oh my
everyone just
God,
figured
yeah.
it was something that was just going to be there always. And they could,
Yep.
always just go down to the store and get. And then all of a sudden the problems of people hoarding it and, trying to make sure that there was enough on the shelves and then limit the amount of people that could buy it. And it's one of those things that's like, it sucks that it has to happen when there's a crisis that we
Yeah.
weren't necessarily prepared. And the crisis happens and then it resolves. And I feel like sometimes it gets forgotten and we don't continue on, like making sure. So that's, the layman's terms. And here, obviously, it's real important. And that's why I feel like it should be discussed about all the time, because this is something, I mean, toilet paper is important, but healthcare is a lot more important.
Well, it's
All
the
right.
hoarding too. You said that very well, because you
Yeah.
think people are just the general public, right? You're hoarding the toilet paper, you're hoarding the masks. This is what I can get my hands on. This is what I'm going to have. And then it shorts someone else. Well, same thing happens in healthcare, right? So, oh, flushes. Let me say, I have a million of them because I put them in my pocket every day. But really, then you have those that really don't have that access, and they're trying to come up with a substitute, or how can we make this work? And so it is kind of, it's hard to imagine, but to talk about it all the time and to keep it on the tip of your tongue, because it gives you processes and ways to flow through that. I think that that's super helpful.
Yeah. All right, let's go a little deeper on how these shortages and recalls increase the risk to the patient, because I know it makes sense that it will, but it's not always obvious. So are there any, I know you already talked a little about the neuropathies, Anne Marie. What else?
Well, I think, any of these shortages or recalls, it creates risk to the patient just from a delay of care, right? Patients are now, I know we saw that with a few years ago, there was a major IV fluid shortage. And despite some, efforts in conserving what current product hospitals had, there still were some delay in care for patients. The neuropathies I just mentioned, that is certainly a delay in care for many patients that we've seen. And that's scary to be able to think. I know, Sarah, you mentioned reusing masks, right? What, how can we be safe? And that means, a patient comes in, if the worker can't protect themselves, right, against, what the patient may be coming in with. And, staff have to be safe too. They can't just, as much as they want to run to attend to a patient, they have to maintain their safety. They have to also be safe so they can continue to carry on and care for their patients, care for their family when they get home, and not bring that, these types of things to their family. And I think that it's important that we understand that it's, both ways, that it's that delay in care, but it's also, the safety aspect of it. And it gets a little scary, when you say, oh, this surgery that you need so badly, we can't provide that for you. Or the care that you're coming in today to see, we can't see you because we can't protect ourselves to be able to see you. So please don't come in. The doors are closed.
Yeah. When I think about, you can come up with 3 different ways for this, right? And it all involves the risk, right? So
Yeah.
you either don't have the product available, or you're substituting the product, or it's delaying the care. And so, I mean, really, if you don't have the product, then you don't have the product, you can't care for the patient. So it either stops the care or it changes the care. And
Yeah.
so then that change comes with the substitution, right? So we know better, I think, as healthcare professionals, that a substitute isn't a flush isn't a flush. Like, sometimes there are variable differences. And so sometimes it makes sense and it's very interchangeable, but other times it's not interchangeable, and you are putting that patient at, not at risk. Well, you could be putting that patient at risk, but clinically it's not going to work because you're changing the process of what you're used to doing. And so the delays, I mean, with all the delays, they're not just inconvenient, really. It truly can change that outcome. If you can't care for a patient because you don't have the supplies or you don't have the proper equipment, at the end of the day, it doesn't just impact the supply chain, right? It impacts the patient care. It introduces that variability into care. And that's where that risk lives, right? Where the variability is. And so if you don't have the product, you can't care for the patient. So you're trying to change it with a substitute. And does that substitute clinically safe? And then are you delaying care even further because you can't find that substitute either? So it does pose some risk, but it also poses some change, and and change is hard. That's I always like to say, change is
Right.
hard. We preach it all the time, like it's super easy, but change really is hard, across the board in healthcare and your public and within the public realm, and even in your personal life, change is hard.
Yeah. It's like the domino effect, right? Like
Yes.
every, action has a reaction and it just keeps going. So it's like something you could think of that is so small, like an exam glove or the mask, like it becomes so important and so critical in these times. So
it's important, from a value analysis perspective that, that's why we always talk about inviting people to the table and making sure that we have interprofessional collaboration, because it's not just us putting a substitute product on a shelf and hoping all goes well. Fare thee
Right.
well. I hope you figure out how to use it. Right. And so it's working with not only your industry partners, but working with a team of professionals who are very adept at using the original product, and having them check out, what is this new product? What are the differences? How can we educate the staff to use that? And how can we ensure that we're conveying that? So conveying that, whether it's in-depth education, or even sometimes it could be used the same way, but just, hey, here's a heads up, it's a new product, because even the packaging sometimes can just throw a nurse off, right? You're so used to looking for that blue bin or that blue package, right? And then all of a sudden one day it's red and there's none and you can't find it. Right. And nurses, right? We're so driven to that, we're always used to grabbing that same one, and suddenly we don't see the one that blue one anymore. Now we're going to try and find our own workaround, because we're going to get that done, right? And we're very creative at
Of
times,
course.
sometimes to our detriment. And so it's all about that communication too.
Yeah, I can see once again, all of this is happening in crisis mode too. So,
Yes.
and that's kind of leads almost into the next question, because staying on top of these disruptions, it's something that I feel we can't really predict, like the weather. Like, you might know it could happen, like we could have this, but at the same time, I feel some of these products are not, like, they have expiration dates too. So how do we stay on top of these?
I think to stay on top of it, it really comes down to communicating, right? So being proactive, connecting with the end users that do use it, like Anne Marie said, and really been truly just being transparent. Like, you're really working hard on this, and we really need to work together. And so let's collaborate and do it together. I think part of it is we obviously can't do it alone. And so that scale matters. And so those people that you are inviting to the table, is it the right people? Are they the ones that are using the product? Are they the ones that can help gather the product? So your GPOs, are they helping in these shortages as well? And then to have that strong relationship with the vendors and those relationships to where they can help you out as well, I think it's pretty important. I just think that really bringing the same, like Anne Marie has said it a couple of times, but bringing those people to the table and just having those discussions and being open and honest and saying, we need your help. So let's rely together, and I will figure this out if you can figure this out, and distribute that workload, because you can't take it on alone.
Right. I think the other part to that is also identifying at your facilities, what are those critical items? I think that there's an art to that, right? Because, we never would have thought that certain items, like N95s, was going to be a critical item, but we found out, yes, it could very well be. And so identifying those areas, maybe it's a high volume item, right? But maybe there's not a lot of substitutions behind it, right? So how, at your facility, I know there's some third party items. There's less sophisticated ways, just going through your bins and saying, okay, is this a critical, would we deem this a critical item? And what's that criteria to deem criticality of the item, right? Are there a lot of substitutions available? Do I have a lot of relationships? Are there a lot of people, vendors who are manufacturing this? Is there diversity of the manufacturing? Right now, we even have to know where these things are being produced and where is the raw material being harvested from, right? You have to know everything down the supply chain, because, when you sit at those tables and you have those discussions, you sometimes you need to have that insight on, do I have repetitive options in this product? And how can I get that? And how can I identify those items where if I'm running low and I can't get a sub, I have a big problem on my hands, and I need to be very reactive or proactive, actually.
Proactive, yeah.
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 Yep.
Yeah, those are great points, but you can also look at your data points too, right? Like
Mhm.
we rely on the nurses to give us like what products are, going to be interchangeable or the critical ones in the future, but looking at your data and tracking your data
Mhm.
points and seeing, is there a change or is it,
Yep.
staying the same? Because maybe a slight change can trigger, some questions that then say, okay, we might be going into a shortage, like we're going into the winter months. So
Yep.
are we going to see an influx in this, and let's start preparing, right? I think one of the takeaways is that it's what happened in 2020 taught us to be a little more prepared
Yeah.
in different ways. So really utilizing your data, and internally, AI is a big thing now. So let's use
Yeah.
AI, let's use those machine learning tools that, we have at our hand to be able to track historic usage and when it's changing, I think is equally as important as identifying the critical items.
I think
Absolutely.
that was the first time, I have to say, in 2020 where I got a lot of emails from customers, and they would say, we don't have any more of this. What other companies are buying that same item that I can look at? What other
Yeah.
companies are out there? Can you help me? And I got a plethora of those messages. And so, which then I was thinking, this is great the way we group our products together, because I could just select in the database, oh, I want this product and this grouping. And oh, here's all the other alternatives that are out there that we have
Yeah.
categorized. And,
Yes.
I could quickly send that off. So it's really nice to, whether you use a third party solution or build your own, right? So as you're moving through and you're finding subs, make sure you're capturing that data so that you can
Mhm.
then refer to it, because, next time it's not typically a one and done, right? I think we've seen now this is going to be cyclical. Right now
Yes.
we're
Yeah.
11 years later from, 11 or 12 years later from the first Ebola crisis. Now we're kind of heading into there. Throw a hantavirus in there too. And suddenly, people are looking at, fit testing, N95s again, and, you know, making sure again, how can we build that resiliency? And that's, I think, capturing that data is important.
Yeah.
Yeah, absolutely. It's another way of being able to actually get evidence, rather than just saying, oh, I think this makes sense that we're going to run out of this because of that, but actually having the evidence, sometimes it's not exactly what you thought.
Yep.
So the data
Yeah,
is
those
very
trends are
important.
nice to
Exactly.
look at through the data, right? Like you can see the trends. If you can see the ups and downs, and you know what to
Yep.
expect and when to expect it. And so you were totally spot on, Keegan, when you're talking about using the data for that, because it is super helpful. Because
Mm.
even us, we're reviewing the data and looking at it, you don't see those slight nuances sometimes. And looking at those small things may actually impact later on down the road something big. And so to be able to see it visually and to be able to look at it and analyze it is super helpful to see. And to figure out where you're going to land coming up, or anticipating that. So you are proactive and not reactive.
Exactly. I know we mentioned a few times about bringing like the right people to the table. Do you have a little bit more, who specifically like should be part of these conversations?
A few that you always have to have. You would always want to have risk involved, right? Because anything that you're going to do is going to change. Whether it's change when you change your products, you may have to change your practice, right? So risk is always, or quality. Sometimes they're bundled together. Infection control or prevention is always going to be at the table. obviously you need, supply chain is and value analysis, right? Those two are going to be working hand in hand. And then, the products are, mainly where, whether it's OR specific or, whatever that department, that lead department, or maybe it's the nursing council you need to have at the table, right? Because it touches everywhere in the facility.
Yeah.
I don't know if anyone else has, if you're lucky enough to have an analytics person on your staff, I think, to talk about run some of those data points and keep track of that. I think that is helpful to have them as part of that conversation. I don't know, Sarah, Keegan, am I missing any? I'm sure I am, but
If you have a good relationship with certain suppliers in
Yeah.
that area, bring them to the
Yeah.
table, right? Like,
Mhm.
yeah,
I think that's or a distributor, someone on
Yeah.
the other side, it might be worth
got it.
bringing them to.
I think you hit the non-negotiables, right? And so that's the people that have to be there.
Mm.
And so it's not necessarily about having more people at the table, but it's having those right perspectives, right?
Yeah.
Because you think about that, every shortage is a clinical decision, is an operational decision, has a financial decision, and it's all happening at the same time. So if you miss one of those non-negotiables, it's going to impact it down the road or it's going to impact it immediately. And I think it really just depends on the timing and how long the shortage is going to be.
I think, Sarah, you also mentioned earlier the buzzword of transparency, because I think that's a real important one,
Yeah.
and making sure that that there is cooperation and everyone is working together, because this is not an isolated, once these shortages and recalls happen, it's not just isolated to one facility,
Right.
So I know for me, when I've been able to go to conferences and able to hear everyone working together and sharing their solutions, I feel like that is also, this is a global issue. We all have to work together and not make it a competitive thing. So
Right.
didn't know if there's any specific professional networks we want to discuss that could help if anyone needs
Yeah.
to reach out.
Yeah, I mean, I think we mentioned your GPO is a great one to rely on. Your professional networks you're going to want to also, as a, you know, value analysis, you're not going to be there alone. There are going to be, like you said, other hospitals. So AVAP is going to be, another place you can go to and say, hey, what are you doing about this? What are other products you're reaching out to? What are some
Mhm.
caveats to implementation so that I can do this safely, right? And, hopefully someone else has that experience and hopefully they're willing to share. Same thing, for supply chain arm, right? We want to look at again those, what are some possible substitutions or anywhere that you can build that network and have these discussions. I think it's really important. If you have a collaborative that maybe your hospital that's local to you that you belong to, or your local chapter, your state chapter, the hospital association or ACHE, right, is another one that you would want. American College of Healthcare Executives. That's another one where you'd be able to find that network of hospitals that are going through exactly what you're describing.
Yeah. And I think the other thing, sometimes subscribing to those alerts within the governmental and regulatory agencies can really help because if it's something that's coming up, it should notify you ahead of time. And then really and truly, honestly, to me, we name all of the professional networks, right? But that peer-to-peer sharing, not just the vendors, but peer-to-peer across all of the networks that you have is super helpful because sometimes the best solutions come from just the neighbor next door, right? And you're thinking, why wasn't I thinking about that? Where did that come from? But two heads are better than one. And I mean, again, it comes down to inviting those people to the table, and whether that's via a text or a simple email or something like that, just to say, hey, we're really struggling with this. What have you done? Using that peer-to-peer group really helps. And then knowing those shortages that are coming up. So the FDA website and things like that, and governmental agencies that really help. So you get those alerts.
All right. Do we have any final words on part one? Part two will go more into now how to manage, these shortages successfully. But any final thoughts for today's episode?
I'm just thinking, I think preparation is key. And I know we'll talk about some of that in the next episode. Today we talked a little bit about, the awareness around it. And all I can think of is the quote is never let a good crisis go to waste. Right. And sometimes it's like, it's like you go through it. Don't waste that opportunity, in moving forward. Make sure you kind of do an after action report and really look at it and say, when I went through, maybe Ebola the first time or COVID the first time and the second time and the third time and the IV fluids and this, each time you should be learning and building and restructuring and making you a little bit more resilient, building those networks and really, again, learn something from it, right? Don't just go through it.
That's a great ending.
Absolutely.
Such a good spot, spot on.
So with that in mind, I think that's a wrap. So thank you all for joining me today and for everyone out there listening and watching. Make sure to like and subscribe wherever you are enjoying this episode so that you'll be informed when part 2 airs and other episodes. For more information, you can visit our website at bluepointscs.com or any links in the podcast or video description. I will include some of those organizations that we mentioned and websites as well. And remember, best practice doesn't have to cost more when you slay your data with BluePoint. Until next time, bye.
Bye.
All right, well, I don't think we had any bloopers today, guys.
All right, well, that's good.
Well, Anne-Marie disappearing, trying to plug her thing in. I think.
Yeah, I can be like,
oh yeah, besides that, it's like vanishing me. I'm like, wow.
I know. I thought you fell out of your chair or something. Come on.